Hi, and welcome to APO's American Armenian Health Professionals TV Health Program. Today's program is deep vein thrombosis, short DVT, which is clot in the veins, and it can really affect our health significantly. Today we have a specialist with us, Dr. Debra Ferman. She's an hematologist oncologist, and she's board certified. Dr. Ferman, welcome to our program.
Thank you.
Deep vein thrombosis is very common. I see a lot in my practice too, and it can be very insidious and dangerous. Can we explain to our audience or people what is deep vein thrombosis? How did it come about?
Okay. A deep vein thrombosis is a blood clot in the leg. It can come about by many ways. If you have trauma to the leg, if you have thickened blood for any reason, and the risk of a clot in the leg is that it can travel to the lung and potentially kill a person.
There are certain risk factors that it can actually, there are certain things that people can get clot without knowing it. That's being sedentary life, right? One of them can be after surgery they can have,
yes,
probably,
yes.
right? After surgery. Some hematological issues.
True.
Right? They're excessive clots in their producing excessive clots somehow. Cancer probably is one of them that, right?
Yep. So surgery, being immobilized,
Right.
having orthopedic surgery, that's why they give preventative blood thinner after
Right.
surgery to prevent blood clots. Cancer, as you said.
Right.
Pregnancy can also be a risk
Pregnancy,
factor.
right.
Certain medications can make one prone to clots, like hormones, oral contraceptives, hormone replacement therapy.
So people that they take oral contraceptives should be careful about that. And there are certain things that actually we tell patients, right? Don't smoke and take oral contraceptive. Or certain age probably that we don't give oral contraceptive anymore because of the clot issue.
True,
Right.
over 40 usually.
Right. So what do we do if somebody having surgery that we usually give in the hospital certain medications to prevent that? There are certain medications for clot formation, dissolving the clot actually. Can we talk about that a little bit?
Sure. So preventative medicines, there's heparin, Lovenox, which are shots that they give for a certain period of time after the surgery. And based on this surgical procedure, it depends on the length of treatment.
Those are the shots that they get under the skin in the abdomen sometimes or in the arm.
Correct.
Right. So that's given in the hospital once or twice a day, depends which medicine it is. Right. And there are some oral medications too, right, that we have?
Yes, depending on the surgery, knee replacement, they can give a certain pill for, they're called direct thrombin inhibitors, or the novel oral anticoagulants, which inhibit 10A, and they're given for like 30 days or so after a procedure.
Right, that's the knee surgery.
Yeah.
But sometimes the hip surgery, hip replacement, actually any orthopedic surgery, after orthopedic surgery, unless they're mobilized, they're on blood thinners for a while.
Yeah, because hip surgery is a very high-risk procedure for getting blood clots in the legs.
Right. And besides the surgeries, actually, if people are sedentary, they can actually develop blood clots, right? And they should be careful with that. So we should recommend that they should be mobilizing themselves and not to stay in the bed long time or so on and so forth.
Correct. Long car rides and plane trips are also risk factors, so I usually tell my patients to walk every hour on the hour. When they're in the car, they should stop the car and go to a rest stop, or if they're in the plane, they should be one of those annoying people that goes up and down the aisles so that they can, and in the seat, they should pump their legs, like move their ankles up and down.
Right. Do you recommend aspirin type of antiplatelet agent?
They've done studies on that, and really, in the olden days, they'd say take an aspirin before you go on a plane, but really that doesn't help because it's not a real treatment. Really what you have to do is talk to your doctor about your risk for blood clots, and now they have these novel oral anticoagulants which you could take like a dose or two before you go on the plane, and then go on your plane ride, and then on the way back you take it also to prevent blood clots.
Right, especially these are long flights, really.
Yeah.
Yeah, so aspirin, besides aspirin, so they can be given, other agents can be given to the newer agents.
Yeah, which work better than the aspirin. Yeah.
Now, which one they usually recommend? Because one of them is twice a day.
The rivaroxaban
Okay.
is used before plane flight. But it's really an extrapolation, but they do that or aspirin.
Let's talk about now, somebody has deep vein thrombosis, what kind of symptoms they would have, what kind of symptoms they should look for, that they should alarm them that, oh, okay, I might have a clot in my leg.
When one leg is more swollen than the other, pain in the calf, tenderness in the calf, redness in the calf, that's signs of blood clots in the leg. And if you have that, you should go see your doctor right away or go to the emergency room.
Right. So the swollen leg, pain in the leg, right? And then sometimes redness, and especially walking, they get pain. That's
Yes.
important too, right? Immediately that they should seek attention. That because if they don't, then if the clot travels, as you said, that have a condition called pulmonary emboli, they can be very dangerous.
Yeah, and I've had patients who have pain in their leg for a few days, and then all of a sudden they walk and their pain in their leg goes away, but then they develop shortness of breath and chest pain, which is exactly the clot traveling to the lung.
Right.
So,
Say it again. That is like shortness of breath and chest pain, sudden onset.
yes.
After the leg pain is gone,
Yeah.
actually sometimes, but they have the pain now. They feel short of breath.
Yes.
And that's a significant sign for pulmonary emboli. Actually, it can be very dangerous unless it's treated immediately.
And even passing out, chest pain with deep breathing in, shortness of breath are what you should look for.
Right. Somebody has, let's say, pulmonary emboli. So how do you treat pulmonary emboli? The clot now is in the lungs. Do they have to stay in the hospital?
That, it depends. There are certain algorithms that the docs use for determining risk. Usually, I mean, I would prefer if they're staying in the hospital. It also depends on vital signs, like if the patient has a blood pressure or if the patient doesn't have a blood pressure. For massive pulmonary embolism, you treat it differently, meaning if the blood pressure is affected and the heart is affected, sometimes they put you on, they do TPA, thrombolysis, a very strong blood thinner, or even send you to a heart surgeon for immediate heart surgery on bypass. But that's a very rare situation. Usually patients just have symptoms of chest pain and shortness of breath. Their blood pressure is okay, and they're just treated with blood thinner.
So when somebody has pulmonary emboli and that they're in the hospital now, they're being treated with probably intravenous medication or blood thinner, and they go home. How long usually they stay on that blood thinner for pulmonary emboli?
So active treatment for a blood clot, either pulmonary emboli or DVT, is 3 months, and that prevents the clot from growing. After that, you have to assess the risk of the patient to see whether they require lifelong blood thinner or not. So the most important thing in evaluation is the history. Was the clot provoked, or was it just spontaneous out of the blue? If it's provoked, meaning if you had a reason for it, like surgery or being immobilized, then you do 3 months and you're done.
And that should be enough.
And if it's just out of the blue, unprovoked, then you have to discuss with the patient whether they'd want to be on it lifelong, because then the treatment is just secondary prevention to prevent a new blood clot from coming. And then you assess the patient's hate factor. It's like a Coumadin or blood thinner hate factor. How much do they hate being on the drug? If they really hate being on the drug, then maybe you'd stop after 3 months.
And the good news is that the new medications do not need any blood tests, like old medication, Coumadin, that you had to do blood tests constantly to arrange the dosages.
Yeah.
Dr. Ferman, thank you very much for coming to our program. It was very enlightening. Now it's time for this week's article. It is nuts consumption and inflammation. Nuts are rich in unsaturated fat, plant protein, fibers, vitamins, minerals like magnesium, and phenolic antioxidants. Studies have shown that intake of nuts is associated with decreased risk of cardiovascular disease, diabetes mellitus, and healthy lipid profile. Also, nut consumption has protection against inflammation and vascular reactivity, which are the important part of the process developing heart disease and type 2 diabetes. Previous studies have shown that nut consumption inversely associated with body mass index, and weight loss has been associated with decreased amount of inflammatory biomarkers, CRP and interleukin-6. Inflammatory markers have been identified as independent risk factors for cardiovascular disease and insulin resistance, and they can be reached with the blood test. Recently, researchers from Harvard Medical School investigated habitual nut consumption in relation to inflammatory biomarkers. For Nurses' Health Study, they analyzed 50,000 participants' nut consumption and inflammatory biomarkers like CRP and interleukin-6 levels in the blood, and follow-up was for 10 years. In conclusion, this study showed that greater nut intake was associated with lower concentration of CRP and interleukin-6, which are inflammatory biomarkers. Substituting nuts for red and processed meat, refined grains, potato chips was associated with healthier profile of inflammatory markers. So for a healthy snack, instead of chips, on cookies, have handful mixed nuts and seeds and decrease your inflammation and have a better cardiovascular health. Good health is precious and priceless. Keep informed. Visit APO's website for more up-to-date information, aahpo.org. I'm Dr. Ohan Karatoprak. Until next program, so long.